Hi, I'm Ahmed,
And I'm Kelvin.
and today the Medicator will be exploring the issue of statin administration. Let's imagine a scenario. Patient X is a 56-year-old man with no history of cardiovascular disease. He goes to a clinic one day, and his physician informs him that his high cholesterol levels put him at risk of developing cardiovascular disease. His physician then proceeds to prescribe him a statin, a prescription drug that decreases the synthesis of cholesterol.
While you may think this is a common occurrence, it is not. While 18 million Canadians are currently at intermediate risk of cardiovascular disease, only 4 million Canadians are receiving lipid-lowering therapy. This is a huge treatment gap. You might be wondering, what is the cause of this gap and who's at fault?
The truth is, this can be attributed to both physicians and patients. Physicians fail to correctly diagnose and treat this disease, while patients fail to comply to statin treatment even under physician supervision.
To combat this treatment gap, some have suggested approving over-the-counter statins, which allows access to statins without a prescription.
OTC statins is a highly debated topic, with the two sides remaining very divided. Supporters of OTC statins argue that this can narrow the treatment gap and lower the economic burden, while opposition argues that loosening access to statins could result in unnecessary health risks due to patients inaccurately assessing their need for statin therapy, resulting in misuse.
Clinicians play a key role in determining a patient's need for statins. Without the intervention of a physician, patients may misinterpret blood test results and take an over-the-counter statin when it's not really required, putting them at unnecessary risk. In fact, in early over-the-counter statin trials, 20% of people buying over-the-counter statins were at too low risk, and an additional 25% of people didn't take the mandatory cholesterol testing beforehand.
High-risk patients are equally susceptible to drug misuse. In fact, in the same trial, it showed that 23% of low-dose OTC statin consumers were too high risk for the drug. This can be dangerous, as the high-risk patients require additional secondary prevention measures in order to manage their risk.
In addition, current over-the-counter drugs are currently for fast-acting relief. On the other hand, statins must be taken on a regular basis for the benefits to take effect. Since cardiovascular disease is long-term and asymptomatic, patients may not have a lot of motivation to continue taking statins without physician supervision.
It can also be difficult for physicians to correctly track the patient's medications, resulting in possible adverse drug-drug interactions.
With all of these apparent issues, you may be wondering, would over-the-counter statins at least help to bridge the treatment gap? Well, it's certainly likely. A 10-year cost-effectiveness model predicted that over-the-counter statins would reduce major vascular events by 290,000 and reduce revascularization procedures by 130,000 in the next decade. In addition, over-the-counter statins would save the healthcare industry $10.8 billion and reduce physician costs by $9 billion.
Keep in mind, however, that this could also result in misuse. Despite the several benefits presented by this initiative, others can be implemented, such as implementing a patient education program, as well as implementing stricter guidelines for adherence to medication.
But hey, that's just our 2 cents. If you'd like to learn more about the topic, read our article in issue 30 of The Educator, titled Over-the-Counter Statins, A Gateway to Misuse.
Until next time, it has been The Medicator discussing the issue of statin administration.
Thanks for watching.